Good evening. My name is Avnish Jadhav, and I'm joined here today with Nandini Sinha and Shreya Srinivasan. Today, we're going to be interviewing Mrs. Wilson about cystic fibrosis. Ms. Wilson, would you like to introduce yourself and how long you've been working in this field?
Hi, yes, I'm Vinette Wilson, and I have been a nurse for about 30 years now. I'm currently a nurse practitioner and work in the area of family medicine, and I am currently a teacher at Chattahoochee High School. So I've been working with the students as well.
So, in our thing, I would like you to explain, just a brief explanation about what cystic fibrosis is.
Cystic fibrosis is a genetic issue. It's inherited from parents. And what happens with cystic fibrosis is the mucus becomes thickened, as well as enzymes and the fluid within the body because of the genetic mutation. So people tend to, it's usually diagnosed pretty early on, about a month into birth or into life rather. And from there, they start to get sick. A lot of times they start to get, like pneumonia or respiratory illnesses because their their mucus has become thickened. So it becomes a perfect medium for bacteria to grow. And they'll start having issues breathing, colds. Sometimes they'll start having issues with their digestive system. Um, and it becomes a lifelong issue and that has to be managed. And although I know when I first started out in the industry of healthcare, life expectancy was pretty low, roughly in the 20s, but it has definitely improved since then.
So, I was also wondering, are there any non-medical treatments for people with cystic fibrosis?
Dietary is always a plus, having good dietary habits. Um, Taking care of their overall respiratory health as they get older, not participating in things that would make their respiratory health become worse, such as smoking and vaping and things like that. But usually they don't because they've been sick for a long time. Um, let's see, I'm trying to think of some of the other things because a lot of them are medical interventions that we do. But there's also like chest physiotherapy, things like that to help loosen up phlegm and keep things moving because that the mucus becomes so thick and stagnant that that's one of the things that keeps a lot of patients sick. So putting them on respiratory treatments, making sure they stay hydrated, making sure they have a good diet. Sometimes supplementing the enzymes because the ducts from the pancreas get blocked a lot of times, so they don't secrete enzymes. So then they end up with a lot of bowel issues, dietary issues, digestive issues, and things like that. So putting them on enzymes. So some things that are just kind of like an everyday thing, well, not for everybody, but sometimes little supplements will help to help break down some of their food and fats and stuff like that.
Um, do you think there are any type of therapies that might be helpful for this?
Any types of therapies? They are looking at some genetic technologies and some alterations, gene therapy, things like that. That is in the works from my understanding because things have changed quite a bit to improve life expectancy. So I know there's some other modifications and new medications out there to help thin mucus out and keep things clear and keep the body from reacting and becoming inflamed internally.
What could possibly happen if someone didn't seek help for cystic fibrosis?
Life expectancy would go down pretty quickly because that is a lifelong issue from birth, and that's they usually start recognizing it right after birth because their mucus is so thick and sticky, not just thick, but sticky. So when you don't have mucus that moves, you start having issues with the pericardium. I'm sorry, the pleural cavity, all of that. So you can have all kinds of issues. So if you don't seek treatment, most likely you won't live long. And it also depends on the level of cystic fibrosis that you have as well, because some people have a mild form of it and they don't have as strong of a reaction. And then some people have a severe case of it. So it just depends on the level of severity.
Okay. Once people get into older stages of life and they get accustomed to using treatments, would they have to use more rigorous treatments, or how would that work?
Not necessarily, because if they've been balanced for a long time, usually it keeps them in a state where um, they're not progressing in the disease necessarily, although they can progress. But if they've been managing it for all of these years, for several years, it just reduces the progression of it. So not necessarily having to take a whole lot more medicine, but they have to continue to manage. So the life expectancy now has gone up to about 50, where it used to be the early to mid 20s. So we've come a long way, but management is the key, keeping infections down, and keeping keeping the lungs clear.
What are your opinions on the new technological advancements that are like occurring in healthcare right now?
The new technological advancements in healthcare overall or for cystic fibrosis?
For cystic fibrosis.
I am honestly not sure what the new treatments are. I honestly need to look that up, because when I managed cystic fibrosis, it was usually, I used to work pediatrics in pediatric intensive care. So they would come in through the patients would come in through there. And that's where I would see most of my cystic fibrosis. I haven't worked with cystic fibrosis, honestly, in a while now. Most of my patients, even though I am a family nurse practitioner, but most of my patients have been adults because I work more internal medicine.
Could asthma symptoms be intensified due to cystic fibrosis?
Oh, absolutely. If they have asthma on top of cystic fibrosis, it makes it that much more difficult to manage. So, because trying to get air out of the lungs, coupled with the thickness of the mucus and stickiness of the mucus, it makes the alveola pretty much collapse and stick together. So it takes a lot more rigorous treatment. So those comorbidities make a difference also, not just the severity of the disease itself, but any comorbidities that they may have.